Welcome back to PT Monday, where we dig into the real root cause of pain and functional decline, and how metabolic health plays a bigger role than most people realize. I am Dr. Rose, the Primal Professor, and today we're talking about three of the most common musculoskeletal issues I see in the clinic: tendinitis, bursitis, and plantar fasciitis. And here's the spoiler alert: they're not just about overuse. Your metabolic health has a lot to do with why these problems start and how quickly they heal. Most people think these conditions are purely mechanical, that tendinitis is just from repetitive motion, bursitis is just from friction, and plantar fasciitis is just from being on your feet too much. And while that's partly true, it's not the whole story. If that were the case, every runner, every tennis player, every nurse would have chronic pain, and they don't. The real question is, why do some bodies heal and adapt while others stay inflamed and painful for months? So let's start with the basic. We're going to talk about the mechanical side first. Tendinitis is inflammation of a tendon, often from repetitive microtrauma, meaning that you're doing the same motion over and over again. Bursitis is inflammation of a small fluid sac, and that's called the bursa. And it's there so it cushions the joint, like if a tendon is going over the bone, so it doesn't fray, right? Think of it that way. And then plantar fasciitis is irritation of the thick band of tissue along the bottom of your foot. Think of it supporting that arch, and it's supporting all your weight. These often happen from overuse, poor mechanics, weak stabilizing muscles, or too rapid change in activity. Those are important and they absolutely need to be addressed, but here's the catch. If mechanical stress were the only factor, rest, stretching, and physical therapy would always fix the problem quickly, and yet many people continue to struggle. So let's get to the metabolic root. That's where the metabolic health comes in. Chronic inflammation, often fueled by insulin resistance, high blood sugar, high insulin levels, poor diet, and visceral fat, makes your body's tissues vulnerable to damage and slower to repair. Here's how. Elevated insulin and glucose levels trigger systemic inflammation. So a small mechanical irritation becomes this big inflammatory storm. And we've talked about these before, advanced glycation end products, or AGEs. These are sticky molecules formed when sugar binds to proteins, and your connective tissue is made up of proteins. So stiffened tendons and connective tissue making them less elastic and more prone to injury. So poor metabolic health also reduces blood flow and collagen synthesis, slowing down healing and increasing the risk of chronic pain. It's like trying to put out a small campfire in the middle of a drought. The spark isn't the issue anymore, it's the fuel feeding it. That's why you hear all the time people who are diabetic have trouble with wound healing, right? They have trouble with healing in general. So the best result comes from addressing both sides. Mechanical, strengthen the supporting muscles, improve flexibility, correct biomechanics, and avoid sudden training spikes. Like, don't go play 3 matches of tennis when you haven't played in 10 years. Metabolically, you want to lower the systemic inflammation by improving insulin sensitivity, cutting back on refined carbs and seed oils, prioritizing nutrient-dense whole foods like protein, and support healthy body composition. And when you pair physical therapy with metabolic repair, it's so powerful. You're not just treating the pain, you're changing the terrain that allowed it to develop in the first place. So the next time someone tells you your tendinitis or plantar fasciitis is just from too much use, remember this. Overuse might light the match, but poor metabolic health is often the gasoline. Improve the foundation, your blood sugar, your insulin sensitivity, and your inflammatory environment, and not only will you heal faster, you'll be far less likely to deal with those nagging issues again. This is Dr. Rose. I'll see you tomorrow in the next Daily Spoonful.